Good afternoon. Whether you're here for as a first-time attendee or a familiar face, we're grateful for you being with us here today. My name is Lauren Oto, and I'm the Executive Director of the CalAsian Foundation, and I'm looking forward to our discussion today with Dr. David Chan. As we head into the holidays, we all get pretty busy, so it's a good reminder to take it easy on ourselves and take a little break. Before we begin today, I'd like to take a moment to thank CVS Health for partnering with us to bring you today's content. I'd also like to recognize our AAPI Strong program partners and sponsors. Their support has enabled us to provide educational resources, mental health support, and community-focused trainings and webinars. Thank you to our partners, California Department of Social Services, Stop the Hate, the Sierra Health Foundation, PG&E, and PepsiCo Foundation. It is now my pleasure to introduce Dr. David Chan, Senior Medical Director of Clinical Quality at Aetna Medical Affairs, where he oversees clinical integrity and quality measures and provider performance tools. He holds degrees in biomedical engineering from Johns Hopkins, an MD from Harvard, MIT, and a master's in business operational excellence from Ohio State. He completed his pediatrics residency and chief residency at University Hospitals of Cleveland and is a certified health insurance executive through America's Health Insurance Plans. We're excited to welcome Dr. Chan as our honored guest. Thank you for being with us today.
Thank you for the introduction, Lauren. I'm going to share my screen. Okay, so as Lauren said, my name is David Chan. I'm a Senior Medical Director of Clinical Quality for Aetna. And in that role, my primary responsibility is really focusing on how we measure provider performance as it relates to clinical quality. On the clinical side, I'm a pediatric hospitalist, so I've taken care of patients ages 0 years to about 25 years of age who have been hospitalized for over the past 20 years now. And I'm really excited to talk to you today about this topic. I want to be able to give you information, and hopefully it really empowers you to take control of your overall well-being. So most of us might think about physical health and mental health as being two separate entities. But as a physician myself, I've really seen how mental health impacts physical health, how physical health impacts mental health, and how they're both really important for overall well-being and for community resilience. And I think the relationship between physical health and mental health really came to the forefront of public health during the COVID-19 pandemic. As the lockdown went on for quite a bit of time, people were isolated from each other. I think people became much more comfortable speaking about their struggles with mental health. So I think that although the pandemic was not a good thing, I think that that really helped bring the importance of mental health to the forefront. So we're going to first talk about physical health. We'll be talking about preventive care, diet, sleep, and physical activity. And along the way, I'm going to be giving you quite a few suggestions and recommendations throughout the webinar today. And I hope that many of them will resonate with you. But I don't want you to leave today feeling like this is a prescriptive list. I don't want you to think you have a large list of a to-do list or homework. These are just suggestions. Think of it as a menu at a restaurant and select what is right for you. The second thing I want to add is that I'm going to be giving very general guidance about physical health and mental health, but you want to talk to your doctor in case there's any specific individualized recommendations that are more appropriate for you based on your individualized health conditions. So after we talk about physical health, we're going to talk about mental health, specifically what is mental health, how to best manage stress, and the importance of social connectedness. And lastly, and actually throughout the webinar today, my goal is to really explain to you how these two are intrinsically tied to each other and greatly influence each other. Throughout the webinar, I'm also going to try to share some of my personal experiences with overall well-being, as well as some of my observations as a physician with regards to overall well-being. Okay, to start off with, we're going to start with some mindfulness exercises. I saw many comments in the chat about how calming the music was, so hopefully I can follow that theme with some mindfulness exercises. So these are meant to bring our attention fully to the present moment, allowing us to feel more grounded and centered. These simple practices will guide us in becoming more aware of our thoughts, sensations, and surroundings, fostering a calm and focused space. Personally, I know this is something I need to work on. I actually work from home. I have a 49-inch monitor divided into 3 screens. I have 2 cell phones, and I have to look at 3 email accounts. And so I know how difficult it is to really be in the present, to really be in that moment. So one of the things that I know I have to take these exercises home with me and practice them as well. So I'm going to take you through 2 exercises: box breathing and the body scan. I'm going to tell you how each of the exercises work, and then I'm going to actually lead you through each of them. So the first one is box breathing. As the name suggests, it is a breathing technique. It can heighten performance and concentration while also being a powerful stress reliever. One thing I learned is that actually Navy SEALs use this box breathing, and you can imagine how they must perform in some very highly stressful environments. So they actually use this to center themselves and actually to help them sleep. And so you can imagine it must be very effective if they use it. So the way the technique works is you're going to breathe in for 4 seconds, really expanding your stomach so that you're breathing with your diaphragm rather than your chest, so over 4 seconds. At the top of that breath, you're going to hold for 4 seconds. And then after the 4 seconds, you're going to slowly exhale with control over those 4 seconds, releasing any tension in your body as you do. And this exercise is really, you're really hyper focused on the breathing mechanics. You're almost focused on that air moving in and out. So that's what you really want to concentrate on. So let's go through two two breaths of the box breathing. Okay, so the first one. So you're going to breathe in for 4 seconds. So 1, 2, 3, 4, and then hold at the top. 2, 3, 4, and then exhale slowly. 2, 3, 4. Okay, we'll do it one more time. So we're going to breathe in over 4 seconds. 2, 3, 4, and hold at the top. 2, 3, 4, and exhale slowly. 2, 3, 4. Okay, so hopefully that helps you center. The next exercise is called the body scan. So as you bring attention to your body, begin to focus on the sensations that you feel. This could include feeling the surface that your body's resting on, the temperature of your body, or the texture of your clothes against your skin, and so on. So for the body scan, I think it works best for you to close your eyes, begin at your feet, and work your way up to your head. And I'm going to actually lead you through the exercise. And after we're done, then we'll have you in the chat enter just anything that you learned, any surprises. So let's do the body scan. So start with your feet, then your lower legs, your thighs, your pelvis, abdomen, your chest, then move to your back, your arms and hands, your neck, and then your head. So you can slowly open your eyes and prepare to ground in your senses and surroundings. So go ahead in the chat. What did you notice? Did anything surprise you? Did you find these as relaxing as the music? I should say. Let's see. Two comments about posture. Yeah, I noticed that too. Especially as I said, I work from home and I'm sitting a lot, and I noticed that my posture my posture needs improvement. So we have two posture comments. Good. Okay. So I hope that these are two exercises that you take home with you. We're going to referring back to these. We're going to be referring back to these throughout the talk as ways to really enhance both physical health and mental health. Okay, so let's move on and talk about physical health and why this is a key part of mental health and overall well-being. So when I talk about physical health, there are four aspects that we're going to focus on. That's preventive care, diet, sleep, and physical activity. Okay, so when it comes to preventive health, there are four key areas that we should focus on. So the first one are regular medical and dental checkups. So in addition to physical exams, preventive care visits include screening and testing. So remember, medical tests, these are medical tests that check for diseases early. And for the most part, if you can identify disease early, it may allow for an easier and more effective treatment process. The second is dental cleanings. I think that oral health often goes overlooked or is forgotten. But there's actually a proven association between gum disease and such chronic conditions such as diabetes, coronary artery disease, high blood pressure, and high cholesterol. So don't forget your dental visits. And finally, education and counseling. The whole point today is about giving you information. I look at doctor's visits as another opportunity to talk to your doctor, to learn to ask questions, and to empower you to become a much more informed, proactive decision maker about your own health. The second aspect is knowing your family history. So, your family history is a record of health conditions in your family tree that may be passed down through your genes. So, if you have a family history of chronic illness, you can decrease your other risk factors by changing unhealthy behaviors that can lead to chronic diseases such as smoking, poor nutrition, physical inactivity, or excessive drinking. So you can't control your genes, but there are behaviors that you can control that can help reduce your risk of these diseases that run in your family. So you want to talk to your doctor about how to prevent chronic diseases that run in your family. The other thing is, I think it's really important to let your doctor know about family history. In fact, a lot of your electronic health records these days will ask you to enter those in so that it's in the history, because that can actually impact treatment decisions. Or, for example, let's say a type of cancer runs in your family. Perhaps you need to be screened at an earlier age or more frequently. So it really can impact how the doctor manages your health, which is a good lead into number three, which are cancer screenings. I think the overall theme with cancer screenings is, for the most part, the earlier that you can catch cancer, the more treatment options and usually the better outcomes you have. So that's why it's so important to keep up with cancer screenings, which include breast cancer. So the usual screening age for the general population is ages 40 to 75. Cervical cancer. So the PAP test can help find cervical cancer early when there are more effective treatment options. And the PAP test can also identify cells in the cervix which can become cancerous. So also providing more options for to hopefully enable a more positive outcome. Colorectal or colon cancer. So these tests can find colorectal cancer early when more treatment options are available. There are now many stool-based tests which are available for those at general risk, as well as the gold standard of colonoscopy. And the usual screening age is now 45 to 75. So that's been reduced from age 50 because we are starting to see colon cancer at earlier ages and trying to figure out exactly what is causing that. And finally, lung cancer. So annual lung cancer screening is recommended for those aged 50 to 80 who have a history of smoking. And the last aspect of preventive care are vaccinations or immunizations. So they're a key part of preventive care and help prevent serious diseases and save lives. So there are routine vaccinations such as the annual flu vaccine and now what looks like it will be an annual COVID-19 vaccine. And there are also core vaccines such as Tdap, which stands for tetanus, diphtheria, acellular pertussis, the hepatitis B vaccine, and the HPV vaccine, which is the human papillomavirus vaccine. Most of us are familiar with how many immunizations children get to prevent a lot of diseases. A lot of those will last a lifetime, but for example, the Tdap booster is needed because some of those immunizations you get as a child, their effectiveness wanes over time, so you need that booster. And there are some vaccines that are specific for adults, especially as you get to age 50 and older. There are vaccines such as the shingles vaccine, an RSV vaccine, or a pneumonia vaccine, which are indicated to prevent more serious disease as you get older. Okay, the next aspect is diet. So, diet is an essential part of maintaining physical health. So, a balanced diet plate should include the five major food groups. So, we'll go through each one of them. So, fruits, which include all fruits and 100% fruit juice. They can be fresh, frozen, canned, or dried and dehydrated, and they can either be eaten whole, cut up, pureed, mashed, or even cooked. So the recommended portion of for the fruit group is 2 cups, which is the equivalent of one medium apple and one large banana. The second food group is vegetables. So it's any vegetable or 100% vegetable juice. They can be raw or cooked and can be fresh, frozen, canned, or dried. They can be whole, cut up, pureed, or mashed. So lots of options with the fruits and vegetables. So the recommended portion is 2.5 cups per day, which is the equivalent of 2 large bell peppers and 6 baby carrots. I would say most of us probably struggle to get the recommended portion of vegetables, and this is probably the one food group that you could probably go over the recommended amount. So always good to get your vegetables. On the other hand, grain is probably the one that we struggle to limit the portion of. So grains include any food made from wheat, rice, oats, cornmeal, barley, or another cereal grain. This also includes our breads, pastas, breakfast cereals, grits, and tortillas, which are other examples. And even foods such as popcorn, rice, and oatmeal are also included in this group. So lots of options. So the recommended portion is 3 to 6 ounces per day, of which half should be the whole grains. So that is the equivalent of 1 slice of whole grain bread, 1 cup of cereal, and 1 cup of popcorn. The next group is the protein group. So it's all foods made from seafood, meat, poultry, and eggs. This also includes beans, peas, and lentils, which, by the way, also qualify as the vegetable group, and then nuts, seeds, and soy products. So the recommended portion is 5.5 ounces per day, which is the equivalent of 1 egg, 1 cup of cooked beans, peas, or lentils, and half an ounce of cooked seafood, meat, or poultry. And this is my favorite food group, is the protein food group. Lots of good food there. And then the final group is dairy. This includes obviously milk, cheese, lactose-free milk, fortified soy milk, and yogurt. It does not include foods made from milk that have little calcium and a high fat content. So I guess that's probably like ice cream. All the good the stuff that tastes really good is in that section there. So the recommended portion is 3 cups a day, which is the equivalent of about 1 cup of yogurt, 1 cup of milk, and 1.5 ounces of cheese. And this is the one in terms of the changes I made. I think the for me the biggest challenge has been the portion size. I saw one comment. It did look like quite a small amount of food when I looked at this. This might be kind of the recommendations based on a general diet, so it's not going to be for everyone. But for me, it was portion control, and that was just eating what the recommended portion was instead of eating until I was full. So that was the challenge for me. All right. The next one, and this is one where I've made a significant amount of changes, is getting sleep. And I've seen a lot more studies now just talking about how important sleep is to overall health. I think we all can relate to how we feel and perform when we've had a good night's sleep and how we feel and perform when we haven't had a good night's sleep. So why is sleep so important for physical health? So it can do such things as boost your immune system, help you maintain a healthy weight, which then in turn lowers the risk for serious health problems such as coronary artery disease or diabetes. It improves your mood and social life. It supports cognitive functions, helps you think more clearly so you can perform better at work or at school, helps you be able to form long-term memories, and it helps with judgment and making good decisions, avoiding injuries. We all know how many car accidents are caused by drowsy drivers these days. So tips for developing good sleep hygiene habits. So you want to adopt a consistent sleep schedule, which means going to bed and waking up about the same time every day, even on the weekends. Using that hour before bed for quiet time. So that means shutting off the TV, shutting off that smartphone, perhaps reading a book, avoiding heavy or large meals within a few hours of going to sleep, avoiding nicotine and caffeine because they act as stimulants. Spend some time outside every day. Getting some exercise also usually helps you sleep better at night. And you want to keep your bedroom quiet, cool, and dark. And the one other thing that's on this list is practice some of the mindfulness exercises we're talking about. That box breathing, that grounding the senses helps you relax and is more conducive to sleep. Okay, so I'd like to play an interactive game that we can all engage in. So in the next couple of slides, I'm going to be presenting you with a couple of prompts, and then you'll utilize the poll function to respond to. So when the question comes up, I want you to go ahead and use the polls to enter in your response. So the game we're going to be playing is called Sleep, Fact, or Fiction. Okay, so the first statement is adults need less sleep as they get older. Is that fact or fiction? So go ahead and enter what you think is the right answer. Give it a couple more seconds. I think we're going to have a consensus answer here. Okay. So about 80%, 80-20 here went with fiction. And that is the right answer. So older adults still need the same amount, but sleep quality can worsen as you age. So older adults are also more likely to take medications that interfere with sleep. I don't know about you, but I certainly know that as I've gotten older, I feel like I need more sleep. So I would have definitely gone with more sleep for that one. Okay, the next one. This one's a little harder. Fact or fiction? If it takes you less than 5 minutes to fall asleep at night, you are probably sleep deprived. Is that fact or fiction? All right. Do you want to? Okay, so this is much closer. So 60% said fiction and 40% said fact. It's actually a fact. So if it takes you less than 5 minutes to fall asleep at night, you are probably sleep deprived. So ideally, falling asleep should take 10 to 15 minutes. So that was a learning one for me. Okay, next one. This is our last one. Fact or fiction? You can catch up on sleep on your days off. Is that fact or fiction? All right. So we have our final results. 85% said fiction, 15% said fact. And it was fiction. So after one bad night of sleep, taking a nap or sleeping longer the following night may be beneficial. But after a week's worth of insufficient sleep, the weekend isn't enough to catch up. So I think that really talks about the habits. If you're not getting enough sleep over time, it's really hard to just catch up on those days off, on those weekends. It's going to be a cumulative effect on your body. So really encourage you to develop those good sleep habits. Okay, we're going to move on. And the final one is physical activity. So my big emphasis on this one is to take baby steps. You don't want to get injured, especially if this is something you haven't been doing. It's really about just getting moving. The other thing I wanted to point out is it doesn't have to be that complicated. A lot of the examples we're going to show, you don't need to belong to a gym in order to get good exercise. But this can be especially challenging for those of us who work at home and sit a lot. I know that I need to force myself to get up, to just walk around. If it's possible for me to stay on the call and move away from the screen, just to keep moving, it's very important. And this also may be challenging depending upon your health condition. So we've got to find the way that works for you that just allows you to get some movement. Okay, so what are the types of physical activity? So there's aerobic activity, which includes moderate aerobic exercise, such as brisk walking, biking, swimming, and even lawn mowing, so some household chores, and vigorous aerobic exercise, such as running, swimming laps, heavy yard work, and aerobic dancing. So this past year, I did something called the 75 Hard Challenge, which was a 75-day program. And part of it's that you actually had to exercise twice a day. You were supposed to do it for 45 minutes for each session, so an hour and a half a day, and at least one of them had to be outside. So I live in Northeast Ohio, And I was doing this in January, February, and March. And so I definitely counted the days where I had to go out and shovel the snow as one of my exercises because I was out there for at least 30 minutes. I was definitely sweating and my heart rate was definitely above normal. So even just building in household chores, you can count as exercise. So that's aerobic activity. So you also want to add in some strength training, which can include using weight machines if you have them, using free weights, so dumbbells or barbells, using your own body weight, so doing sit-ups, push-ups, pull-ups, air squats, using heavy bags or other things you have around the house, or using resistance bands. So a lot of options for both aerobic activity and strength training. So what about the recommended amount of physical activity? So aerobic activity. So the recommendation is at least 150 minutes of moderate aerobic activity per week. So they say that's roughly 30 minutes per day, 5 days per week, or at least 75 minutes of vigorous aerobic activity per week. So if you're doing that more vigorous, the recommendation is you don't have to qualify for as many minutes to meet the recommended amount. And you want to aim to spread out aerobic activity over a few days in a week. You don't want to overdo it. So that's with aerobic activity. With strength training, you want to do the exercises for all major muscle groups at least 2 times per week. One set of each exercise is usually enough for health and fitness benefits, and usually you want to use enough weight or resistance so that your muscles are tiring out at about 12 to 15 repetitions. So those are the four aspects of physical health. So my one question for you in the chat is, out of these four, which one was the most challenging or is the most challenging for you? Is it the preventive care? Is it following a healthy diet, sleep, or getting the recommended physical activity recommendations? Sleep. Oh, okay. We have two sleeps. See, it's one of those ones that people don't really think about. Diet and sleep, physical activity. So we're getting everything, physical activity. Yeah, I mean, physical activity, it's the time, right? We all have busy lives, and it can be very hard to integrate physical activity. What I forgot to mention is I actually do it right first thing in the morning. So it's one of the first things I do is I work out, try to work out every morning. I find that if I wait to the end of the day, then things come up and there's many more excuses available at the end of the day. But when you do it right when you get out of bed, there's usually nothing that can get in the way. It's as long as I can get out of bed, if I can make it. I have a gym in my garage, so I just have to make it out to the garage. So that's what I've done. So looks like physical activity and sleep are the big ones here. So, oh, warm blanket. Yes, that's why I said that the biggest challenge is getting the blanket off, and if you can get that weight off, then getting the physical activity is good. So, as I said, try to take one or two of these recommendations home with you to try. You don't have to try to do all these things. It's just getting one, that one, like I'll say baby step. Just do one of these things and then try to add on something else little by little. That's the way to improvement. Okay. So now that we have talked about physical health, let's talk a bit about how to integrate both physical and mental health for overall well-being. So I really like this graphic on slide 18. So what we're targeting is that middle. We want that intersection or that overlap between physical health and mental health. That's where we can achieve overall well-being. So, as I mentioned, your physical health impacts your mental health, and your mental health impacts your physical health. So, for example, depression is linked to an increased risk of physical chronic conditions such as diabetes, heart disease, and stroke. And at the same time, physical chronic conditions are linked to an increased risk of developing a mental health condition. One of the biggest things I want to emphasize about today is that these two are really integrated. It's really hard to have physical health without mental health. It's really hard to achieve mental health without physical health. You really have to work on both. And I think this example, it makes a lot of sense. So if someone is depressed, some of the typical symptoms are they may be isolated, they may not have enough energy to exercise, they may not be eating very well. So you can see all the things we talked about: a poor diet, not getting physical activity, puts you at risk for these physical chronic conditions such as diabetes and heart disease. And at the same time, I think we can all understand that someone who has one or more physical chronic conditions, how that can predispose them to depression, anxiety, isolation. So sometimes it almost becomes, what comes first, the chicken or the egg phenomenon? Which comes first? But really, the answer is they're just really tied together, and so you really have to address both of them. We need to work on that together as a society. All right. So now that we've covered physical health and its linked to overall being, we're going to move on to mental health. But before we do that, I want to just do another mindfulness exercise with you. So part of our goal today is being an overall talk on overall well-being is we want to keep you engaged, we want to keep you moving, keep you stimulated throughout so that you're not just sitting looking at a screen. So we're going to be doing another exercise. This is called grounding in the senses. And if you can either write these things down, or if you can just remember them. For each of our five senses, I'm going to just be asking you to do a few things. And then afterwards, we'll open up the chat for you just to enter anything that really surprised you or stood out to you. So we'll start with sight. So name five things that you can see. All right, now we'll move on to hearing. So name four things that you hear. All right, for this part, if you need to, I'm going to actually, if you need to stand up or move around, name three things that you can touch. All right, name two things you can smell now, or if you remember smelling earlier today. And then finally, name one thing you can taste or tasted earlier today. And as I think about the mind and the body, I think of those last two. If we think of, I know someone mentioned pizza earlier. If we all think of pizza, I think we can almost taste the pizza in our mouth. I think we start to salivate, right? It's how our mind can really, how close it's linked to our body, that we can actually experience those sensations just by thinking about something. So open up the chat. Is there anything that surprised you about that exercise? Any thoughts? Yeah, the smell part. Yeah, I think the smell and the taste, as we got to those definitely were the more challenging. So yeah, I gave you the out by saying, what did you remember smelling earlier today? Machine noises. Yes. Yeah, I can hear. I have my headphones on, but I can hear my heater. Yep, yard work, cars. Very good. Okay, great. So feel free to continue to enter things as thoughts come up. But we're going to move on to mental health. And it can be a very difficult topic for many to talk about, but it's important that we actively have conversations about it to reduce stigma and shame. So, in this next section, I'm going to talk about mental health, and we're going to talk about what exactly is mental health, what are some ways to manage stress, and really the importance of social connectedness. So, before we move on, I'd really like to hear how you all define mental health. So, when someone says mental health, what does that mean to you? So we'll use the chat function just to get your input. It doesn't necessarily have to actually be a definition. It can be just what are the almost word association. If someone says mental health, what does that mean to you? Take a moment to check in with yourself, your world. Stress management, peace, ability to stay grounded. Very good. So a lot of the exercises we did today, hopefully you'll take away for mental health. Peaceful mind, acceptance of who you are, harmony. Yeah, that's a good word, harmony. Personal well-being, both mental and physical care. Very good. Thank you all for your input. Great. Self-care is very important. Yeah. Yeah. So I'm glad that came up, how important self-care is, especially with the mental health. So this is one way of talking about what mental health is. So mental health enables us to cope with the stresses of life, realize our abilities, learn and work well, and contribute to our community. And it can be categorized into three subcomponents. So there's emotional health, which is day-to-day feelings and maintenance of a healthy emotional state. This includes the ability to cope with positive and negative situations and feelings. There's psychological, how a person thinks, feels, and acts. And finally, social, how a person interacts with others and maintains healthy relationships. So, when it comes to mental health, managing your stress levels is crucial. So, let's take a look at some statistics here. So, 40% of workers in the US report experiencing work related stress. One fourth report work as their biggest source of stress. So I imagine that most of us can relate to this one, that at least some part of the day or some part of the week, that work was a major stress in your life. What are the top five causes of stress? Financial burdens, job pressures, health concerns, relationships, and poor nutrition. Certainly, over the last couple of years, we've seen inflation go up. We've seen um, just the issues with jobs that came up through the COVID-19 pandemic. So there's been a lot of stress over the last couple of years, all related to these things. So it's not surprising that these ended up being the top five identified sources of stress. So, what are some signs of stress? So, there are physical symptoms such as aches and pains, chest pain, exhaustion, headaches, dizziness or shaking, high blood pressure, also known as hypertension, muscle tension, stomach or digestive problems, and a weakened immune system. So you can get more sick more easily when you are stressed. So when I look at this, I see almost every body system named here as having a physical manifestation of stress. And as a physician, I see this as challenging. So, for example, if someone comes complaining of chest pain and dizziness, are they having a heart attack or is it actually a sign of stress? And so it's really, as a physician, I've seen even in our pediatric and especially in our adolescent patients, that when individuals present with physical symptoms, I need to evaluate what are all the possible physical health conditions that could be causing these signs or symptoms, and what are all the mental health or behavioral health conditions that could cause this. And it's becoming something more frequent that I have to talk with adolescents or their parents that could this be something psychological? Would you be interested in actually speaking with our psychologist and becoming much more comfortable, as we said, talking about mental health and physical health together, being more comfortable offering that as possible things that we're considering. So those are the physical symptoms of stress. They can also manifest as behavioral symptoms, such as an alcohol use disorder, a gambling disorder, development of an eating disorder, smoking, or substance use disorder. So those are how stress can show up. But there are ways that you can help manage stress. So there's taking care of your mind and taking care of your body. So let's start with taking care of your mind. So first, take breaks from news and social media. I know probably a lot of us, especially with the election just passed by, that we were probably overburdened by a lot of commercials and just saw a lot. And I think we just needed a break. So Take breaks from news and social media. Take time to unwind. So we went over three mindfulness exercises. So those are examples. So breath work, stretching, meditating, keeping a journal, spending time outdoors if you can, and participating in relaxing activities. Practice gratitude daily. Actually, we just had a journal club recently where we looked at an article that looked at the effects of practicing gratitude daily. And this population they looked at was actually a group of nurses that they followed, I think, since 1970. So followed them for decades, just to see what health conditions they developed. But there was a whole thing about assessing those who practice gratitude, and those who did had a less chance of actual mortality than those who did not practice gratitude. So they actually, at least in this population, showed through statistically that practicing gratitude actually had significant health outcome effects. And then connecting with others. We're going to talk about social connectedness next. And then taking care of your body. So it's almost everything we've talked about. So it's getting enough sleep, staying physically active, eating healthy, limiting alcohol intake, avoiding smoking and drug use, and keeping up with prevention and screening. So just emphasizing again just how integrated physical health and mental health are. Okay. So, using the chat, I'd love to hear from you. What are your favorite ways to manage stress, especially if there's anything that we missed on that list? Shopping, hiking, combat sports, get out some of that aggression. So, both physical exercise and I think a stress reliever, very good. Journaling, yoga, drinking a hot cup of coffee, working out and reading, taking a walk. Good. Looks like people have their go-tos for managing stress. For me, I really find that daily exercise really helps. Especially starting off in the morning, I think it really just gets my mind ready for the day. So I'm seeing a lot of activity, yard work, especially gardening, coloring. So we have some art. Yeah, did we not mention art? Yes, I think a relaxing hobby. So um, art. I didn't think. I also like to cook. I find cooking to be relaxing. So maybe we should add that to our list. Especially, I guess we should be cooking healthy foods to make sure we're consistent with the message today. Cleaning. Yeah, I guess sometimes cleaning can be both you're getting something that needs to be done, so there's getting that off your to-do list, which I think a to-do list can be a source of stress. So clearing that off and then getting a little physical activity. And then I think cleaning, you get to see the outcome of a clean house. So there's that gratification. Vacation, yes, we definitely need to take use of our PTO days, get out and see the world. 7 puppies. Wow. Yeah, I am an animal lover as well. I think we'll come up with our social connectedness. I think animals definitely are play an important role in physical and mental health. I think there's actually studies that show that those who pet owners that it actually petting a dog or a cat can actually help lower your blood pressure. So I think there's definitely some health outcome benefits from pets. And I think especially having a dog, they kind of force you to take them out to go on a walk. So it helps motivate you to exercise. Good. So we got a lot of comments. So I think we all uh, recognize the importance of managing stress, and we have oh, someone said pass the stress to someone else. Delegating stress. Okay, great. All right. So hopefully you've learned some ways to manage stress from our list and then from other participants on this call. So I've mentioned social connectedness a couple times. So let's move on to that. So social connectedness is important for mental health. So, for those who feel lonely and isolated, there are a number of negative side effects that can impact your health. So, you can see here, they can lead to chronic diseases and serious illnesses, such as heart disease and stroke, dementia, depression and anxiety, type 2 diabetes, suicidal tendencies and self harm, and even an earlier death. So, let's look at some statistics. So, about 1 in 3 adults in the US report feeling lonely, and about 1 in 4 adults in the US report not having social and emotional support. So those are really striking statistics if we think about the mental health crisis to see these numbers. That's a lot of people. But there are promising approaches to support social connection. For example, psychological therapies, community-based exercise and physical activity. We've talked a lot in the stress release about activity. We're seeing a lot more now technology and phone-based programs. So I'm seeing some startups and other companies who are designing apps or other ways to keep, especially the elderly with chronic conditions, more connected with family, loved ones, or just someone to talk to. Health education, skill development, support groups, and peer support. If you're in school, school connectedness, intergenerational programs, and as we talked about, animal-based interventions. And I think participating in group activities like we are right now are also very helpful, just to stay connected, even if it's not in person, just to have conversation, sharing of ideas with other people. So, with that in mind, we are actually going to practice social connectedness. So, in a few moments, you'll be placed in a breakout room with a partner. So, get to know them, exchange names and a few fun facts. And then, once you get to know your partner, find out something that you have in common. So, we are going to put a list, and maybe we're going to put a list in there. So, in case you need some conversation starters, you can see a few here. So, do you have a favorite book or movie that you recommend to everyone? What's the best concert or live event you've ever attended? Do you have a favorite travel destination? So that came up a lot, or a place you'd love to visit. Are you a morning person or a night owl? What inspired you to pursue your current career or field? Are there any apps or gadgets you can't live without? And are you part of any clubs or organizations that you enjoy? So those are just some ideas to go through. You may have some other topics you want to talk about. So we're going to give you about 10 minutes in your breakout room to go over these questions, learn a little bit about each other, and then when you come back in, go ahead and enter some of your more interesting findings in the chat, and then we'll go through them together. Okay. Hopefully everyone is back. So feel free in the chat to enter anything that people found interesting, anything that stood out to you. I'm interested in the travel destinations. So Janice said that her partner and her are both in AAPI focused nonprofits. Right, guys. If anyone's looking for travel destinations, I went to Portugal last year and I'd love to go back. So highly recommend Portugal. Okay. New York. Oh, getting a lot of comments. I can't even keep up now. Okay. New York, and we bonded over Adele. Reading in coffee shops. Christmas, you're probably happy about now, right? Christmas, I thought movies. Yep, all the holiday movies are on, all those marathons. Greece, yes, on my list as well. Cajun Popeye turkey. I have never heard of that. Yes, so Portugal, and then I'm planning a trip to Switzerland next year. All right, great. Well, I'm Philippines. Yes, I have been to the I am half Filipino, so I've been to the Philippines twice. But the last time when I was 9, so uh, quite a long time ago. Um, yeah, so I hope that you all got to meet someone. Hopefully, make some friends today. Maybe I see a couple uh, are nonprofits, so maybe there's some opportunities to collaborate. Who knows from meetings like this? I'm glad you're all participating today. So keep feel free to add more things there. I'm going to move on and talk about supporting others and the importance with mental health. So when approaching a loved one about their mental health, it's important to express your concern with respect, compassion, and empathy, while also making your support clear. Certainly, this is I, approaching a loved one, a friend about mental health can be very challenging and probably very stress inducing. So here are a few tips, but it's really about listening. I think that's the major theme. You don't have to be a professional to do this. I think most people, I know for myself that just having someone who's willing to listen is usually the most important thing. So listening and asking questions, reassuring your loved one that you care about them, and continuing to invite them without the pressure to participate in any plans, even if they resist invitations initially, are all great ways to make your friend or family member feel seen, cared for, and hopefully more likely to reach out for help if they feel they need it. So, we've outlined a few general tips for how to support others who are struggling with their mental health. So, one, set time aside with no distractions. Number two, let them share as much or as little as they want to. Number three, don't try to diagnose or second guess their feelings. Number four, keep questions open ended. Number five, talk about self care. So that came up when we asked people what they thought about mental health. That came up as self care. Number six, listen carefully to what they tell you. Seven, offer them help in seeking professional support and provide information on ways to do this. And number eight, know your limits. And I think on number seven, not only offering them, but let them know that it's okay. It's okay to seek help. That's if someone had a physical health condition, we certainly would encourage them to see a doctor to help them take care of that. We should feel the same way about mental health conditions. So CVS Health and Aetna offer a number of mental health resources, a couple of which are shown on the screen here. And then you'll be getting a list of resources after the webinar, both from CVS as well as some other additional resources to help with mental health. So I'm gonna read to you some of the offerings that CVS Health and Aetna, some of which are on the screen. As I said, others you'll get the links to. So in select states, consumers have access to in-person and virtual mental health services at Minute clinics, and approximately 78% of patients report a reduction in their depression symptoms. Minute clinics offer depression screenings virtually and in all Minute Clinic locations. CVS Health launched the Be Seen and Be Heard campaign to increase depression screening among underserved communities. In April this year, as part of its Centering Youth Mental Health program, the CVS Health Foundation awarded grants to the Greater Flint Health Coalition, Kentucky Youth Advocates, and Reinvent South Stockton Coalition to support their work in providing accessible adolescent and young adult mental health services. There's Project Health, which includes depression screening at all of its events. So, Resources for Living is on the page. So, it's a workplace well being product which provides a variety of solutions to improve day to day mental health concerns such as stress, anxiety, depression, and more. It takes a comprehensive, preventive approach to members' mental health, improving patient access and driving cost savings, including total medical costs, prescription costs, hospital services, and in network care utilization. As part of its focus on reducing suicide attempts among Aetna members, CVS Health has seen a 16% reduction in suicide attempts among Aetna adult commercial members when compared with the 2019 baseline. There's also CVS HealthSpire, which is our healthcare delivery organization, which includes Signify Health, which screens individuals for depression in every home health evaluation visit, and Oak Street Health, where patients are able to schedule both physical and behavioral health appointments. CVS Health offers a number of mental health resources and guides on cvshealth.com, including a resource center, which you'll get a link for, focused on the unique mental health needs of different populations, from the LGBTQ plus community to the unique mental health needs of different populations. And as part of the Beauty Mark initiative, CVS Health promotes healthier self image and positive mental well being by not materially altering the beauty imagery created for stores, marketing, materials, websites, apps, and social media. So, just some of the things we're trying to do to improve mental health for our communities. And finally, I'd like to just set aside time for any questions that you may have. Please feel free to submit your questions either in the chat, or if you feel comfortable coming off mute, I will do my best to address any of your questions. And I just wanted to thank you for participating today. I appreciated your participation, your questions, and your engagement. And I hope that you leave having learned something to really empower you to take control of your overall well-being. So thank you very much. Okay, so I see one question about consistency in terms of healthy habits. Yeah, that's a great question. And I think, you know what they say about just it takes time to develop a habit, right? It's like something like 30 days, or if you can do something for 30 days, it becomes a habit. So a lot of these things, and that's why my suggestion is pick one thing from this list, whether it's a lot of people said sleep. So work on getting 30 minutes more sleep a day, make that your goal, or whatever it is to get to that goal of 7 to 8 hours of consistent sleep. And it's just about picking one thing and then working on developing it as a habit. I think that's my one piece of advice. All these things are behavior change. If you're having to do them, they're all behavior changes, and those just take time. And I would also say give yourself grace with these. A lot of these can be hard. It can be hard to stick to a healthy diet, so don't give up because you had a day where you had a little bit extra on the ice cream section of the plate. Don't give up. Don't be hard on yourself. It's all about taking small steps in the right direction. Hopefully that helps. I know I wish I could give you the fail-proof way to change all these habits. Otherwise, if I could, I'd probably have a book. I could write a book on it, and then I could be vacationing to Portugal and Greece all the time, probably. Did did I see any other specific questions? I don't think I missed. The best time to start is now. Very true. Although I know with as Lauren mentioned with the holidays, it can be a lot of these things. It's very hard to start during the holidays, specifically a healthy diet, getting good night's sleep because you may have family visiting. There's lots of things going on. So that's why I think January 1st, that New Year's after, or maybe I should say January 2nd, becomes such a popular time to start all those new habits. Well, thank you very much. I'm going to stop sharing my screen and turn things back over to Lauren and Amy.
Thank you so much, Dr. Chan. It might not be a good time to start eating healthy, but it's never a bad time to practice some box breathing or box scan and just remind ourselves to take care of ourselves and others. So thank you very much. Perfect timing. As you mentioned during the holidays, it's always nice to have these little reminders. So thank you again. We do have a feedback survey and would love if everyone could fill that out. It'll be helpful for us to know how you all benefited from the workshop and how we can improve for future events. We would also like to share a collection of mental health resources with you all. They will be emailed to you after the session, or you can scan the QR code on the screen. I know a few of you asked for the slides after this, and I think Dr. Chan were able to share the slides with the group. Is that right?
Yes, that is correct.
Okay. Well, thank you everyone for attending. We will be in touch and happy holidays to everyone. Thank you.